Okay, we'll get started. So thank you everyone for coming today. My name is Charles McKenzie. I'm the chair of the graduate program in medical biophysics. I'm just going to spend a little bit of time today talking to you about our program, give you a little bit of information about sort of what medical biophysics is, what we do, why you might want to take a degree in medical biophysics. There's going to be some links to websites through the talk. There's going to be QR codes for those, so you can just take pictures of those if you want to get links to the websites later. So I'm going to talk for probably about 30 minutes, and then I'll take questions after that. We're going to be recording the talk portion of the info session today, but we'll turn off the recording when we're taking the questions afterwards. Okay, so before we get started today, I want to acknowledge that Western University is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenapehouk, and Chugachton nations. These lands are connected with the London Township and Sommer Treaties of 1796 and the Dish with One Spoon Covenant Wampum. This land continues to be home to diverse Indigenous peoples whom we all recognize as contemporary stewards of the land and vital contributors to our society. So with that, let's start with the big first question. Why would you want to go to graduate school? You're probably in your fourth year of your undergraduate. You might have had enough of this already, particularly after the last couple of years we've been through. Why graduate school? So if you actually know the answer to that question, you're probably not coming to this session today. So you might be unsure why graduate school. So let's talk about some of the reasons why. So particularly for our program of medical biophysics, you might want to come and work on advanced technical problems. We have all kinds of cool technology that we use, and we apply it to questions of human health. So there's all kinds of really neat technical problems that we're trying to deal with. Lots of really cool math, physics, that sort of thing that we're working with. You might want to come to graduate school because you're unsure what you want to do in your career afterwards. Completing an undergraduate degree, you're trying to think about what's next. Maybe graduate school is going to, help you get an idea. Maybe you're thinking about going down a path towards a research career and you want to try it out in graduate school, see how that goes. There's some biomedical jobs that require graduate training. In particular, we have a program called CAMPEP, which is for people that want to go on to a career in doing medical physics, doing radiation therapy. So that's one that actually requires advanced degrees, and there are others. So that might be a reason why you want to come to graduate school. You might just, and we love people like this, you might just really love learning and you just want to stay on the cutting edge and see what the latest and greatest technology is. You'll get a chance to play with all kinds of neat stuff if you come to graduate school with us. And also these degrees, they're going to add credibility and legitimacy to the work that you do, right? You're going to have that credential after your name, that MSc, that PhD that says that you've done something new in your degree. There we go. So other reasons to come to graduate school. This is it's getting a little bit old data now, but this is data on the growth in jobs that require different levels of education. And so you can see that you've got college cégep down here, we've got jobs growth for the bachelor's degrees, and then above all that, above bachelor's degrees. So for the master's degree, the PhD, that's where all the big job growth has been in recent years. So there are lots more jobs requiring those advanced degrees. There's money. So as you can see, if you go on bachelor's degree, you're going to do well. Master's degree, typically you do even better. And a doctorate, you do even better still. So that average salary that you get as you go on to more and more advanced degrees keeps getting higher and higher. So there is monetary reward for spending more of your time in school. Personal and professional development. If you're going to come to graduate school, particularly in our program, we really put emphasis on a lot of these things. We're going to help you develop your ability to advance technology in your field of interest, to become an innovator, to come up with new solutions to new problems, particularly in the medical sciences. We put a big emphasis on helping you become a communicator so that you're going to be able to communicate about what it is that you do, your particular degree, and communicate it to lots of people, both within and outside your field. We want you to be able to talk to the scientists in your field at a very technical level so they can understand the details of what you're doing. We also want you to be able to go home and talk to your grandmother and tell her what it is that you're doing and do it in a way that she's actually going to understand what's going on and think that you're not wasting your time in school. We put a big emphasis on collaboration. We have, as I'm going to show you, a very diverse department. We're very large. We have lots of people spread all over the city of London. And we have people with lots of different degrees. Nobody knows everything they need to know to work on their own project. So we want everybody collaborating with each other and learning from each other when we're working on these projects. You're certainly going to be collaborating with, scientists. You're probably going to have a scientist as one of your supervisors. You're probably working with clinicians as part of your project. Talking to these people, learning how to collaborate with them and communicate with them is a very important skill that you're going to get. And finally, we want to make you into a leader. We want you to be able to lead both yourself and others. One of the things about graduate study is it's not like the undergraduate work. It's not really, particularly in our program, it's not course-based. We have a couple of courses that students take, but really most of your time is spent on your own project, working in your lab, getting your data and so forth. So it's very much unstructured. You set your own time, you decide the priorities, and then you execute on them. And we're going to help you learn how to do that effectively. We also want you to work mentoring other students. They might be your colleagues in graduate school. They might be undergraduates. They might be maybe senior students that are working on something else, but need to learn a particular skill that you've got. So there's going to be lots of opportunities to learn how to mentor people effectively and how to bring them along and make them part of the team that you're working in. Okay, so let's talk a little bit about medical biophysics. So who are we and what is it that we do? So Department of Medical Biophysics at the University of Western Ontario. We are the first medical biophysics department in Canada. We were founded in 1948 by Alan C. Burton. We're kind of an unusual department. We have a fairly small undergraduate program. We only have about 60 undergraduate students in our department. And we're one of the largest graduate programs on campus. We have roughly 110 graduate students in various aspects of our program. And we also have a very, very large and diverse group of faculty. We have about 102 faculty members in all aspects of things that we do. So you can see the picture. This is from pre-COVID, so nobody's wearing masks. But we have a large department, lots of interesting people that you get to talk to. So this is how we like to define ourselves. So medical biophysics it's a multidisciplinary field that encompasses applications of physics, computing, engineering, and mathematics, quantitatively study biological and physiologic processes to develop novel or improved diagnostics and therapeutics for a wide range of human illnesses. And so it's our feeling this goal is best achieved through interdisciplinary learning and collaborative research that crosses the boundaries of scientific and medical disciplines. So that last bit is why medical biophysics is a little bit hard to define. We do a lot of different things, and there are a lot of very different projects that people wind up doing in medical biophysics. Everything from working with cellular migration through building new medical imaging technologies. There's all kinds of different things we do, and so we need a wide variety of people to come in and help us do that. What we really try to put the emphasis on here is this, first off, the human illness aspect. The patient comes first. We're a department of medical biophysics, not a department of biophysics. So everything we do is aimed at some kind of human illness. There's always that background of you're working on some significant problem in human health and trying to help improve the lives of people that are suffering from whatever that is. And then the other part of it, as I've been emphasizing, is this interdisciplinary collaborative outside the box stuff. We don't put strong boundaries around what it is that we do. We use whatever tools that we need to get the job done and to achieve that goal of helping out that patient. So that's why we are so diverse. We have a tremendous range of research. So one of the major pillars that we have is medical imaging, and we have people doing research in pretty much any medical imaging technology you can think of, and we're inventing a couple of new ones. But in particular, we certainly have lots of people doing work in magnetic resonance imaging, in computed tomography, optical imaging, ultrasound, near-infrared spectroscopy. The list goes on and on. We have lots of people working in molecular imaging. So using imaging technologies to image things going on at the molecular level. So things like magnetic particle imaging, which is a brand new technology that we're doing a lot of work in leading the development of. Nuclear medicine, positron emission tomography, all kinds of different techniques to look at things on the molecular level. We do image-guided intervention, so using imaging to guide surgery. So that's, a question of looking at where the lesions are that the surgeon wants to look at, guiding the tools that you're going to deal with that and so forth. So lots of work there. Radiation therapy. So we have a lot of people that work down at the London Regional Cancer Program. And they're in there, they're working with radiotherapy machines. That's where our CAMPEP program comes in for medical physics. We have people doing work on oxygen transport and microvascular function. So how do the blood vessels work? How do they get oxygen to where it needs to be? That lots of modeling work that goes on with that. Lots of biology trying to look at blood vessels as a reacting to this sort of thing. We have lots of work in musculoskeletal, looking at musculoskeletal function, how do joints work properly, how do they fail, and also looking at implants. So when a joint fails, for example, with a total knee replacement, how do those implants work in that total knee replacement? How can we improve the kinds of surgeries that are used to treat those sorts of things? And then we have a sort of broad topic of functional imaging. So not only doing medical imaging to look at the structure of different parts of the body, but also using medical imaging to interrogate how they function, looking at the brain. So that's common when the people heard of where we're actually looking at, how the brain responds to different stimuli. So we can actually do medical imaging to see different parts of the brain lighting up in response to stimuli, that sort of thing. But not just the brain. So we look at the function of the heart, the lung, the kidney. I work in pregnancy. I look at the function of the placenta, different aspects of the fetus, the liver. So all these different things that we look at through the lens of medical biophysics. And this is what a pretty typical team in medical biophysics looks like. So this is one of our students is working on problems in psychiatric disease. So supervised by Dr. Keith St. Lawrence. He's an imaging scientist, works on positron emission tomography, among other things. Collaborating with Dr. Jean Tiberge, who's another imaging scientist that works in magnetic resonance imaging. So looking at brain and using it to look at brain biochemistry and function. And then they're collaborating with a clinician, Dr. Lena Palapanayanan. He's a scientist and a psychiatrist down at St. Joseph's Hospital. And so he's helping them understand the clinical aspects of the disease they're trying to look at. And he's helping the sort of the more physical scientists like Dr. St. Lawrence and Dr. Tiberge understand what are the important aspects of the disease we need to look at. And then they're helping him understand what things are possible and how we can marry those two together. So that's a very typical kind of team that a student in our department is going to be working with. So how do you get started in this and where can you go? So start off just talking about the background of our students. So this is just a summary of the undergraduate backgrounds of our students. And you'll see here, so the largest number of them, they're coming from medical biophysics, largely from our own department here at Western. We have lots of students with degrees in physics that come into our department, but we have a significant minority of students that are coming from outside that medical physics background. So we have students coming in with degrees in engineering, in biochemistry, in the biological sciences, the life sciences, computer science. And all of them are working with us to bring their unique skills that they come into our program with to help us tackle these questions of disease. So there's really not a typical biophysics student. We take people from all different backgrounds. I actually admitted a student into our program last year that had a master's degree in philosophy because they happen to be working on problems in medical ethics. So we really do take people from all kinds of different backgrounds. And it's just a question of, can we find the right fit of your background to a project that we're currently working on? So let's start with some of the different pathways that you can take through here. So we're starting here, undergraduate. So you've done your undergraduate education, come into the Department of Medical Biophysics, and what are some of the paths you can take? So the first one is you can come in and you can do a master's degree. So a master's degree is a 2-year program. It's a research-based program. You're going to do a thesis and you're going to be working on some research project. And at the end of that 2 years, you'll graduate with your master's degree, and then you can go on to, lots of different things. But what our students very often do is they're going on into industry, working as specialists, working with medical imaging companies, with pharmaceutical companies, helping them, use their unique training in medical biophysics to tackle the problems in industry. Some of our students also go on to work on developing their own companies. So, and this is actually an example here of a student that's gone on into medical, working in industry. So this is Andrew Westcott. So he was working with Dr. Paraga. He was working on lung imaging projects and doing machine learning, deep learning to look at these lung images and then predict whether or not somebody was going to respond to a treatment for, in this case, asthma. So he's gone on, he's currently working as a machine vision engineer at ATS Automation. So he's used the skills he developed in medical biophysics. Sorry about that. Are you muted? Okay. So so he's gone on to use those skills in industry. So that's one example of a path you can take. Hang on. Okay, sorry about that. We're getting some feedback in the room. Okay. People go on into the PhD in medical biophysics. They can go into these other industry specialists, these entrepreneur paths. And of course, the PhD is also the entry into becoming a scientist, either in academia or going on into industry. So just another example of one of our former students, this is AJ Rajaram. He did a PhD. He was working on developing monitors for neonatal imaging. So that's what we see down here. So this is actually a medical instrument that he built to monitor the brain of these infants that are in the neonatal intensive care unit. So he was working with the supervisors, Dr. St. Lawrence and Dr. Diop. He got his PhD a couple of years ago, and he's now gone on. He's going down that academic path, and he's now doing a postdoc at Harvard Medical School and Boston Children's Hospital. So he's working on the same kind of technology down in the United States. So that's an example of the academic path. There are also people that go through, they do PhDs, master's degrees in medical biophysics, and then they go into either the MD or sometimes into dentistry. So another example here, this is Dr. Derek Kuhl. He was a graduate from our department back in 2011, I believe it was. And so he worked with Dr. Aaron Fenster, working on developing 3D ultrasound guidance for trying to do prostate biopsies. So trying to do diagnostics in prostate to sample properly where lesions are in the prostate so they can get accurate cancer diagnoses. So he's gone on, he completed his MD PhD, and he's now actually a interventional radiologist at London Health Sciences Centre. And he's also an assistant professor here at the University of Western Ontario. And then we can also go on into our CAMPEP program. So if you come into medical biophysics and you go into the PhD, you can simultaneously to your PhD also get a CAMPEP certification that's going to allow you to go on to be a medical physicist. So this is an example of one of our students that did that. This is Donna Morell. She worked with Dr. Paula Foster when she was here doing her PhD, and she was working on the cellular imaging in looking at where brain tumors metastasize to. And so she did this work with Paula, while also working on her CAMPEP degree. So when you go into the CAMPEP program, you have to be in the PhD to do it, but then you, alongside your PhD work, you take a series of courses, and then that gets you a CAMPEP certification, and that lets you go on and do a medical physics residency after your PhD. And then so Donna did that, and then she came back to London, and she's now working as a medical physicist down at the London Regional Cancer Program here in London. So that's another path through the program. There's going to be more discussion of medical physics. And so Dr. Kathleen Surrey is our CAMPEP director here in London. And she is going to be giving another info session on CAMPEP next week. And I'm going to give a little more information on it in a second. So if you want more information about that, you can go attend her info session next week. This is just some of our students that have gone through CAMPEP here at Western. So Dr. Omar El Sharif, Dr. Yuan Zhu, Dr. Tom Perinovich, and they've gone on and done residencies. So Omar went on to the Mayo Clinic, Ewan went to Harvard, and Tom went on to Johns Hopkins. They've since completed their residencies, and they're now working as medical physicists at various sites around North America. So this is another exciting path for our students. So as I said, there is going to be a Camp Ep info session next week. It's going to be on Thursday from 1 to 2 p.m. That one's going to be online on Zoom. And if you want to attend that, you should go ahead and register for that. There's the link down the bottom there, schulich.uwos.ca/grad-info, or just use the QR code and it'll take you to that page. So let's talk just a little bit about the program details. So what we do in the program. So first thing, let's talk money. So we pay graduate students to go to school. Every graduate student receives what we call a living stipend plus a tuition stipend. So we pay you the amount that you're going to pay in your tuition. And then you also get a living stipend. So for a master's student right now, that's $15,400 a year. For PhD students, it's $16,400 a year. So we pay you that plus tuition on top of that when you're in school. And then these amounts can be increased either by winning scholarships, which lots of our students do. About 40 to 45% of our students hold some kind of external scholarship. And lots of our students also take on TA positions. And this is something that's a little bit different from medical biophysics versus other, certainly departments at Western, is that our students that take a TA, the TA is paid on top of the stipend. In many other departments, the TA is actually part of the stipend. So if you're doing a TA with us, you'll actually get paid that in addition to the living stipend that we list here. This is pretty important. Every student in our program gets an advisory committee. So you're going to have a supervisor that you're working with. So it'll be a particular professor that's working and directing your research and your program. But you're also going to have several other faculty members that are going to sit on an advisory committee for you and are going to help provide mentoring, help you with the, what directions of research you need to pursue. If you have problems, how can we problem solve? So they're going to provide this additional expertise and insight into your project. Most of our advisory committees are typically made up of your supervisor, probably another scientist who's got expertise in the topic you're working on, and probably also a clinician who's got that medical expertise in the disease you're working on. So these committees, they represent your mentors, your advisors, and part of your network of support. So these are people you can go to not only for your research issues, but for, career advice, right? So, how do I become, if you're talking clinician, how do I go on and become a clinician if that's something you're interested in? How do I become a scientist? So they're there to support you and make sure that you're successful moving through your degree. And you're going to meet with them several times during your graduate career. We require that you meet with them at least once a year, and I usually encourage people to meet with them more than that. And then they're always available in between those meetings just to give advice as you need it. Let's talk about some example projects. So these are just the types of things that professors in our department have projects that they're looking for graduate students for right now. So this is one. So this is Dr. Aaron Ward. He's a computer scientist, and Dr. Doug Hoover is a medical physicist. So they had a former student, Dr. Christopher Smith, and he was working on, again, we're coming back to prostate cancer here. So he was looking on targeting needles for lesions that you can see in MRI and figuring out how to get a needle into those lesions to improve radiation planning. This is for a thing called brachytherapy, where you put radioactive beads inside the prostate to try to kill these cancers. They're continuing to work on that project, and they're continuing to look for students to come help them with this sort of thing. So they're looking for people with expertise in imaging, people potentially with expertise in cancer biology, people with expertise in mathematics, computer science, that sort of thing, to work on these sorts of projects. Another one, this is one of our new faculty members, Dr. Semenowitz. And so he's doing functional MRI. So he's doing this sort of data processing where you get time results signals from MRI, and then he's processing to figure out which parts of the brain are being activated. And he's doing this looking at discovering brain mechanisms in reaction to painful stimuli in this case. So he uses a variety of technologies. MRI is here. He also uses this EEG, electroencephalography, combines these two to gain complementary information about the problem he's working on. And so he's looking for people with backgrounds in neuroscience and statistics, neuroimaging, machine learning, computer programming, that sort of thing. So again, a variety of skills. Similar kind of project with a different application. So this is Dr. Sandrine Robopierre. So she's actually a clinician. She's an interventional neurologist here in London. And she's working on trying to predict functional issues that are occurring after pediatric brain injury. So after a baby or an infant has had a brain injury, can we actually predict what their function is going to be 2 years, 5 years, 10 years down the road? She's again using medical imaging to do that sort of thing. She's looking for people that have some coding skills, and programming. Clinical experience would be good. People that have had interaction with healthcare providers, with patients, because you're going to be working with these children and these parents and part of that project. So that's the kind of thing she's looking for. Another new faculty member, Dr. Jeffrey Ng. So he works on musculoskeletal issues. This example here, he's looking on, I'm going to try to pronounce this properly. He's looking on femoral acetabular impingement syndrome. So this is a disease that actually lots of people that you might have heard of, Lady Gaga, Andy Murray, Paul Byron have had. And so he's looking at the function of the musculoskeletal system, looking at the the forces, how the muscles work and that sort of thing, and how it impacts this particular disease. And so he's looking for all kinds of people to help out with that project. So that's just an example of the projects we've got. In a lot of cases, a lot of our investigators don't necessarily have a particular project they're advertising. They're looking for good students, and they'll often fit the project to the student. So just because you don't see somebody that doesn't necessarily have a project they're talking about, that doesn't mean they're not looking for students. And very often we have students come in with unique skill sets, and we get very excited about fitting them into something we're working on. So that's definitely possible. How to apply. So unfortunately, my transcript is covering up my QR code there. But basically, you go to grad.uw.ca, that URL up at the top there. And there's this handy little I want to apply button, and you go ahead and click on that, and then that will take you through all the steps you need for making your application into graduate school. And then there's lots of information on that page about why graduate school, why Western, how to apply, all those, what the fees are, all that sort of thing. So you can get all that information there. Advice for making applications. When you're coming into graduate school, your transcript, your marks, and that sort of thing, they're important. But what's really important is you're finding a match between your research skills and research that a professor is doing, right? So you want a project that interests you and that you have skills in that can help out. So for medical biophysics, you want to go and you want to review the people in the department to find people whose research interests you. So again, that's the URL there. This will take you to a list of all of our faculty. And on that page, you'll see links to all the different faculty, little couple of words about what they do, but then links that often take you to web pages that describe in more detail what they're doing. So you can find that at that QR code there. Be an active agent when you're working on this. Don't just kind of send in an application and just hope for the best. Contact the profs directly. We love being contacted with people that are interested in what we do. We love talking about what we do. So we're very, very happy to get those emails. So don't be afraid about emailing people. But when you do, let them know why you're interested, right? So don't, a generic email that just says, hey, prof, I'm interested in your research, probably won't get a response. But if you're emailing, for example, if you email me, dear Dr. McKenzie, see that you're doing research on, using MRI to look at, fat development in fetuses, and I'm very interested in this because, right, and tell me why you're interested in it and why you might bring skills to it, that's an email that's probably going to get a response. So really research the people, contact them directly. And then if you've had contact with them, when your application comes around, they'll remember they've talked to you. And in fact, you can actually list professors on your application that you're interested in working with. So they'll see that. And if had that contact with you, they're much more likely to look at your application, contact you, potentially set up an interview, and eventually make an offer. Talk about what skills you have, right? Everybody's probably got unique skills they're bringing to it. If you can come up, tell them why you might bring something to their lab that they need, that's going to help. When you're talking to the professors, particularly if you're getting to the stage where you're looking at maybe you're thinking about joining this lab, talk to them about their research. Also talk to them about how their lab works. What's the research? What's their supervision philosophy? Are they somebody that's going to, be managing you on a day-to-day basis, or are they somebody that's going to be kind of letting you go off and do your own thing, and you'll just have contact every once in a while? No supervision style is correct. They're all different styles. They work, and different styles work for different people. But because you are doing a program where you're going to be working with this person for 2 years for a master's degree, 5 years for a PhD, you want to make sure you get a good fit so that their style matches well with your style and helps you be the best that you can be. So you definitely want to talk about that. Right, not just match between this supervision and learning working style. If you get a chance, also talk to the students in the lab. They're probably going to have a little bit of a different perspective on how things go in the lab than the professor does. Good idea to get the student eye view of how things work. And you also want to know that just, it's going to be a good fit for you, that you're going to fit in well with the group working in the lab. Most labs are, have at least a couple of students in them. Some of them are very large. Some of them can be, 8, 10, 12 different students and other people in the lab. Some of them are small. Again, different people thrive in different environments. Some people like the small lab, some people like the big lab. So you just want to get an idea of what that's going to look like for you. Okay, that was where I wanted to get to today, talking about things. So I'm going to be happy to take questions now. We are going to post a recording of this talk as well as the slides on the Schulich website, so that'll be available to you. Also, if you want to know more about supervision projects in our program, if you need help applying to the program, got contact information. So my contact information is there. Charles McKenzie, MedBio grad chair at uwo.ca. Elizabeth Oliveira is here with us. She's our academic programs coordinator. She can help out with a lot of the administrative aspects of things. She's askmvp@schulich.uwo.ca, and we're happy to take questions by email. But with that, we're gonna stop the recording, and then I'm gonna be happy to take questions that anybody has.